for pickleball injuries next. So briefly about myself, I'm a local, I think you skipped a slide, local Memphian, born and raised here, did Tennessee medical school, Camel Clinic residency, and went to Los Angeles and did hand upper extremity fellowship at the University of Southern California. I've been here at Ortho South for about a decade or so. Next. I'll also serve as volunteer faculty at University of Tennessee. Also, I take PA students from Christian Brothers University and team physician from school across the street at Memphis University School. Next. And if anybody has any questions, feel free to chime in anytime. So just our brief outline for pickleball. We're going to discuss kind of the interest and the growing popularity. It is exponentially grown over the last several years. Who plays it mainly, and the type of injuries we have, how do they have the injuries, and when they come into clinic, how do we treat these injuries in orthopedics? And then ultimately, we're going to talk briefly on prevention, if possible, of a lot of the injuries from pickleball. Next. So pickleball, it is an 11-fold increase over the last 9 years in orthopedic injuries. And that's a 349% increase in pickleball fractures themselves over the last 5 years. So that is exponentially grown and continues to grow, which we'll see in a minute. There are at least 9 million pickleball players in the United States, according to data from like a couple years ago. And there's several reasons why pickleball is so popular and has grown like so much over the last few years. Pickleball, first and foremost, it is fairly easy to play, and the access to pickleball really has grown. I mean, there are movie theaters even in town here converted to pickleball courts. They are standalone pickleball courts that are open to the public. And even like gyms are converted to pickleball courts. Outside, indoor, there's a lot of different variations about playing pickleball and how to do it. Other options, it's affordable. Paying for 2 pickleball paddles and a couple wiffle balls, much easier to do than buying a set of golf clubs or something like that. So it's fairly easy to get access to it, but also to pay for it. And it's somewhat easy to play. We'll see this is not quite completely true. There are some injuries if patients are not used to playing that are higher or more common. And it is the fastest growing sport in the United States 2 years in a row, from 2019 and 2021. This is a study from like 2001 or 2021 and 2022. So it very well could even be still the most popular sport in the United States. And it has grown, again, 11.5% over the last 5 years as far as sport being played. Pickleball, who plays it? It is a diverse group. It used to be that mainly older patients would play it, and this sport's been around at least since the 60s, from what I can see. But nowadays, it's become a lot more diverse. It's not just for patients who are usually, older patients who are midlife to older life. It's a big, huge sport also in the younger population, which less than 25-year-old. Less than 25-year-olds or have a 21% increase over the last few years. Pretty funny that John McEnroe plays a lot too. All right, next. So here, quick chart. Would not be a PowerPoint presentation without a chart. So, number of fractures per year, 2005, 2007, very few. Then you come up to the, 2021, 2022, it has doubled from the previous years of 2019, 2020. So this sport is, I think, here to stay for a long period of time, and it's a very popular sport that will likely continue to grow in popularity. Next. So risk of injury. There's very few research on this, but there has been a study showing, how do people get injured? What age groups are they? And so it has been shown that the average age of injury, the most commonly are in their 60s. Patients who are 61, 69 years old, average age is 66. But it is common. Most people who have fractures and injuries from pickleball are usually older than 60 years old. So um, maybe this will change down the road as younger players become more and more involved in pickleball. But right now, most of the pickleball injuries are still patients who are older than 60. Women are more common than men, and we'll go over that in a second. Much of that may be related to bone quality. I think women, especially older females older than 60, have a higher chance of having osteopenia or osteoporosis, which is more fragile bones. So it's easier to break things from pickleball. Most commonly, the injuries are more so in the upper extremity than lower extremity. And most commonly, it's the wrist. The most common fracture is the distal radius fracture. So the most common wrist bone to be broken. But also there are other breaks, such as up in the arm and the humerus above the elbow, or at the ulna, which is at the side of the forearm. Falls are obviously the most common, and that's kind of common sense with pickleball. Very few patients are actually getting hit by the paddle or anything like that. It's more so from falls because of loss of balance or what have you. And other risk is that it's a little bit more common in the winter compared to other time periods. Next. So pickleball injuries, most of these are treated outpatient, which means that these patients are not admitted to the hospital, and that's usually a good thing. Most patients with wrist fractures and hand fractures and even ankle fractures, many of these can be treated in the clinic without having to go to the emergency room. If they do end up being in the emergency room, most of these are sent out after they're temporarily splinted or braced. There's a 19% admission rate. So the patients, if you go to the hospital, to the emergency room, you've got an 81% chance probably you're going to be sent out with a splint or some kind of form of stabilizing your break or injury. And about a 19% chance to be admitted. The people who are admitted, more commonly men more so than women, about twice, 2 times the amount, greater than 60 years old again. And then also breaks not so much to the upper extremity, but more so to the spine and lower extremities. And that kind of makes sense too, because there's always a chance of having nerve involvement. Or, most people who cannot walk are not sent from the emergency room home. Again, women more common than men to get an upper extremity break. But lower extremity, it's about 1-to-1. It's pretty similar to women and men. There has been a link to patients who are not typically playing sports or recreational activities. They have a higher chance of getting injured, and so that has been shown in studies that patients basically from the couch to the court type of patients, weekend warriors, they've got a little higher chance of having an injury, and some of that just is muscle balance and what's called proprioception. So maybe I have a higher chance of having an injury. And then again, most patients who've got fractures, broken bones are 60 and above. Next. So again, most common age between 60 and 69, but about equal greater than 70. Women more so than men. And again, winter more so than the other months. And maybe that's because it's so cold. Most people are staying inside and playing pickleball instead of running or doing other sports outside. Next. So, and they've also shown studies kind of other different sports that, again, women are still, even with tennis and other sports, they're more common than men to have fractures. And that's usually because of poor bone quality. Women, when they get postmenopausal, usually their estrogen level gets lower and the bones get weaker. So there's a higher chance of having a break. And again, the most common break is at the wrist, at the distal radius. Next. Men, again, more common to have injuries to the trunk, to the lower extremities, and be admitted to the hospital, including that of the pelvis, rib, and spine. Next. So, again, between 2002 to 2022, over the span of 20 years, there's been a 90-fold increase in pickleball-related fractures that went to the emergency room. And that is a large number. Most of them, again, upper extremity, more common in women than men. Men have a higher chance of being admitted because usually it's more of a lower extremity fracture or more serious injury. Next. So when an injury happens on the court or gym or whatever, just a kind of common sense approach is, okay, what are we looking at here? And you don't have to be a doctor necessarily to diagnose somebody with an injury. Is the skin open? Is there bone poking out? Hopefully not. Is there deformity? Right? Is the arm crooked? Is the leg bent backwards? Can you see some kind of deformity? Can the patient move the joint? Can they walk? Particularly if it's a lower extremity injury. Usually, if they can't walk, that's something that needs to be seen urgently, whether the emergency room or after hours clinic, or even just a walk-in clinic. So initially, if you're on the court, many times there's not a whole lot to do. If there's a way to wrap it, if they've got crutches to walk on, or even a brace to wear, certainly I think those are reasonable options. Many times these options may not be available. And when these orthopedic injuries do happen, seek help, and not something where I would wait 2 weeks and let's make an appointment and let's wait this thing out and see if it gets better over the next 3 weeks. If you've got any of these injuries, skin's open, you got deformity, you can't walk on it, can't really move the joint, then that needs to be seen. There's many different ways to do that. I mean, certainly ambulance ride, if this is a major injury, huge deformity, obviously, emergency department may be the best option for that. But otherwise, you can make an appointment at Ortho South. There's the number there. You can make an appointment online nowadays. There's a patient portal that's easy to do. And then obviously, like, here's my cell phone. You can text, call me anytime. I take walk-ins, even if it's a Saturday morning, kind of walk you through what's the best step to do. Next. So going through different treatment plans, briefly, shoulder injuries, commonly patients will have a shoulder strain. And much of this is inflammation to the shoulder joint, tendonitis along the rotator cuff, or something called bursitis, which is inflammation of the fluid sac around the rotator cuff tendons. Usually it's painful, particularly with overhead motion or reaching behind your back. Tearness is, for the most part, isolated to the shoulder. Obviously, there are other issues that could happen. There could be what's called a labral tear or slap tear inside the shoulder. There could be a rotator cuff tear. Obviously, fractures, always chance of having a fracture or deformity, clavicle fracture, which is up at the collarbone. So all these are kind of within the differential, different options that could have been injured. Typically, initially it's if you feel like there's not a break, or even there's a tear, a lot of times it's rest it, take anti-inflammatories, keep the motion going. I wouldn't necessarily put it in a sling unless you got some major deformity. If you're seen in clinic, many times we'll prescribe an anti-inflammatory, even offer a steroid shot if the radiographs or the x-rays are normal. We can get patients involved with therapy. The key is to keep the motion going so patients don't get frozen shoulder or stiffness in the shoulder. And obviously an MRI, if the x-rays are normal, MRIs would show soft tissues. So if you're worried about inflammation, tendonitis, rotator cuff tear, etc., an MRI usually would be the study to find that. Hopefully nobody has a heart attack on the court, which is a very non-orthopedic injury. But I think all those are possible injuries that could happen from pickleball or any other sport. Next. So rotator cuff injuries, most commonly it's a fall. Certainly overhead can cause rotator cuff as well. Typically, this is also an injury where we kind of get patients moving. Therapy, obviously, is another alternative. Not all rotator cuff tears need surgery. Many of these can be treated without surgery, particularly if you're older age. It's a lot to go through a rotator cuff repair. Injection, possibly sometimes steroid shots can weaken the rotator cuff. So, but obviously, if it's a patient that's not going to do surgery, it certainly is an option. And then, other option, if you've got a large rotator cuff tear and the tendons are fairly healthy, certainly, surgery is an option. Next. So this is a rotator cuff tear. Looking on the left-hand side, there's the biceps tendon at the very top. I wish I had a pointer, but biceps tendon at the top is right above the shaver, which is the metal part in there. The sockets on the left hand, the balls on the right, and going down the middle right side, on the left-hand column, the middle right side, there's the rotator cuff tear. You can see it on the bottom left. The fibers that go down attached to the humerus, to the ball of the shoulder, there's a kind of a small full thickness tear, and you can kind of see it on the right hand side. I'm actually able to stick this metal probe in there, and that way you can be able to see the rotator cuff tear, and there's the hole there. So we did this arthroscopically, so small incisions with a TV camera, small sutures are placed, and we basically repair that back down to bone. And you can kind of see it on the bottom. The bottom two images show that the rotator cuff is all the way repaired, and same with the kind of the middle of the right image. The tendon is all the way repaired back to bone. You can't see a hole in there anymore, so better chance the patient can heal that. Next. Yep, and there's the tear, and there's the hole, and there's the repair we see on the right-hand side. Rotator cuff tears are hard. They are hard recovery. Usually you're in a sling with a pillow on it for a good 6 weeks. You're doing therapy for at least 3 months. This is a tough injury, if not longer, to recover. And if you need it, certainly it is definitely an option to pursue. And most patients do fairly well after a rotator cuff tear and hopefully get back playing pickleball and other sports that they enjoy. Next. This is a labral tear. So not only can the rotator cuff be torn, but you can have a tear in the labrum. The labrum is the lining of the socket. So on the top right, you can see that I can put an instrument called a rasp in between the torn lining, the labrum of the socket, and the bone itself. And we basically repaired this with 2 small sutures, again, laparoscopic, 2 or 3 small incisions to repair this labrum so that no longer there is a hole between the labrum and the bone, that this is hopefully fully healed. Next. So shoulder fractures, certainly this is another possibility that can happen. Many of these we treat without surgery. You can have clavicle fractures up at the shoulder. You can have fracture of the proximal humerus at the ball, and many of these we treat with sling, or it's called a shoulder mobilizer, or even a hanging arm cast, which is a cast placed at the elbow and wrist to help kind of bring down and help better align that fracture. Surgical treatment, if it's displaced, if the bones are separated, surgery would help stabilize this, have a higher chance of healing, and better range of motion early on to get the patients moving. Next. So this is a proximal humerus fracture. The 2 images to the left, you can see that the ball is off of what's called the humerus. So basically the ice cream scoop is off the ice cream cone. And the images to the right that shows with it fixed. So much better alignment, much higher chance to heal and to get the patients moving fairly quickly within the month with physical therapy to gain back that motion. This is still, we try to treat most things without surgery, but some patients like this, it's so far off that surgery is the best option for the patient in order to get their motion back. Next. This is a collarbone or a clavicle fracture. The break is 100% off, and it's short. Next. And we fixed this patient with a plate and screws. It typically took about an hour and a half to do. And the patient was able to move the shoulder after this fairly well. And I think this patient, in fact, even got his range of motion back even without therapy. Next. This is another image, again, showing, well-fixed clavicle. Next. So going down to the elbow, one of the most common injuries, obviously, is called lateral epicondylitis or tennis elbow. Not everybody who gets lateral epicondylitis gets tennis elbow. In fact, more common than not, most people who get tennis elbow don't play tennis. It's also what's called mucal degeneration. So part of that tendon will degenerate a little bit, so it gets a little bit frayed up. Um, Most of these, I'd say well over 90%, are treated without surgery and do well, and symptoms go away. Um, it can also be involved with repetitive use. Next. Treatment options, typically, there are a bunch of options. The tough part about tennis elbow, it takes so long. Sometimes it takes a good 12 to 18 months for this to go away. Rest, certainly, and give it time are reasonable options. Anti-inflammatories, whether you take gels and rub it in, or you could use a steroid pack, or take oral anti-inflammatories. Bracing can help, and we'll show you a picture of the brace. There's many different types of braces. Steroid shots may help alleviate some of the pain, but I don't think steroids really heal it. Options that do heal it, which are not necessarily covered by insurance, would be PRP, which is also called platelet-rich plasma, where we take blood from you, spin it back down, and inject growth factors, which have a higher chance to heal um, to that site, or even stem cell injections can work as well. Physical therapy or hand therapy, I think it's a very reasonable option. I do think it helps. They can also do something called dry needling to help blood flow into that area to help healing. Acupuncture also has been shown to help, and surgery is always an option. I think it's definitely the last option for tennis elbow if possible, where we remove that part of the tendon and repair it. Next. So there's what's called a counterforce brace. It's a tennis elbow brace, very common to see. Next. And this would be, just a diagram of the surgery where we find that part of the tendon that's got frayed up tissue, remove it, and many times can anchor it back down to the bone with a small little stitch. Typically, patients are in a splint for 2 weeks, and then most of them do therapy for a good month or so. Next. So elbow fractures, this is a very diverse group. There's many different types of breaks, and certainly we're not going to go over all of these. These can be really tough. They can be devastating on patients. Elbows get very, very stiff, and surgery is an option if they are displaced, if the bones are separated. Next. So typically, if you got an elbow deformity, the best thing to do is to get help. Emergency room, clinic, call us, set up appointment, get help. Most of the time, patients will go to the ER and at least get a splint placed, but this is something that typically an orthopedic surgeon is required for. Next. So this example of an elbow fracture, we actually fix this patient's what's called a olecranon, which is the bottom part of the elbow. Then they get injured above it. Next. So surgery was involved, and we basically fixed the elbow with 2 different plates and several screws going across it to help line up that fragment. Next. And these are pictures in the operating room showing now that the break's in good alignment, and she has healed uneventfully and gained back her range of motion and working well. Next. So in the wrist, commonly tendonitis happens, fairly frequently. You can imagine, overuse, racket, paddle sport, very common. Anti-inflammatories, wrist braces, very helpful. In the clinic, many times we will offer a steroid injection. Commonly, the most common one I see is what's called de Quervain's tendonitis. It is tendonitis of the tendons that go to the thumb, right, kind of on the thumb side of the wrist. Most of these can be treated without surgery. Surgery is an option. In the bottom picture, you can see it's relatively a small incision. Most of these are done wide awake, local anesthesia. You could also do it under sedation. It takes about 5 minutes to do. And we release that small little pulley that's overlying the tendons and remove the inflammation along those tendons. Next. So wrist fractures, this is also a very diverse group. Most of these are initially stabilized with some type of splint or brace, depending on the type of break it is. Surgery if necessary. So if there's an unstable break where the bones are separated or short, surgery is typically performed. And once surgery, if it is performed, we get the patients moving fairly quickly. Next. So this is an example of a patient. She's had what's called a distal radius fracture. It is off a little bit from where it's supposed to be. Next. She elected for surgery, and now she's got a plate and screws that's directly up against bone. Next. And it's a much stable alignment, and we got the patient back moving within about 2 weeks of surgery. Next. This is a different break. It is broken not just at the wrist, but it's actually at the forearm. It is a radial shaft fracture. And the bone is 100% off of bone, or the fracture is 100% off, and it's short. There's an overlap of the broken fragments. Next. This is something that is unstable. Next, and it's fixed typically with a single incision and a plate and screws. Now the alignment's back up where the patient needs to be. In fact, this patient was moving about 2 weeks after surgery. Next. And most of these plates and screws that we put in, usually they are not typically removed. Hand injuries are extremely common, right? Hand and wrist are probably the most common of all pickleball injuries to have. Strains or sprains, most patients have jammed fingers. What this is, it's usually ligament injuries to the knuckles of the fingers. These usually improve without surgery. Most importantly, we get patients moving almost right off the bat. We get patients moving so that they don't get stiff, less chance of having hand therapy, and overall less pain. Surgery is fairly rare for these. Most commonly, it's involved with the thumb, stabilize the ligament. Dislocations, you'll be able to see, hopefully, if a patient does have a dislocation, that usually the treatment, if you can reduce it, if it pops in on the clinic, on the court, obviously that's preferable where, patients probably feel much better. So if there's a way just to put it back in place, I think that's very reasonable to do. Otherwise, it's something that's typically taken care of in the clinic, where patients are numbed up, or even the emergency room, and put it back in place. Buddy loops or buddy straps are also placed on either side of the knuckle to help stabilize this. And again, most commonly, we get these patients moving right off the bat. The last thing typically you want to do is to put patients into a big splint that's stiff and bulky, and they can't move it because ultimately they will get stiffness from this. Next. So hand fractures are also a common injury to have. Most of these are stabilized. Again, you can use buddy loops or braces, surgery if necessary. This is a patient who gets injured at pickleball, and you can see the patient has what's called a PIP joint avulsion fracture. So a part of that ligament has torn and it's just carried with it a little piece of the bone. This is a patient that we don't necessarily operate with. It's mobilize. Like, get the patient to hand therapy, talk about home exercise program, loosen it up because that joint can get very stiff. Next. So this is a break. That was an interesting break. Most commonly, I usually put temporary pins in, but this type of break was broken in several different pieces, and it was difficult to really put pins in. So next, we had to fix this with a plate and screws. No matter what form of fixation, no matter what form of fixation is used, we got to get the patients moving. So this is a patient that gets moved, we're getting moved into certified hand therapy right off the bat to get their motion back. Next. So no matter what the injury is, physical therapy, occupational therapy, hand therapy are absolutely essential. At all of our clinics, we can walk into our clinics and know all of our hand therapists by name. Because no matter how well a surgery goes or what type of injury they have, if they're not with the appropriate hands, it's very difficult to get better, and no one's going to be happy with it long-term outcome if they're not getting appropriate therapy. So hand therapy, physical therapy, occupational therapy, all of this is absolutely essential. And that's why in Ortho South we have such a great therapy team, because we depend on them. We depend on them getting our patients' motions back, whether they do surgery or without surgery. Next. So hip fractures, fortunately, fairly uncommon. But again, with older patients, most commonly 60 and above, especially more like 70 and 80, hip fractures is always a possibility. Fractures are typically, if it's displaced, usually we do surgery. This is an example of what's called a rod or nail, where we're able to fix the hip fracture with a screw and a rod that is actually inside bone, where we get patients walking right off the bat. The other, form of hip surgery that also could be a possibility is a hip replacement. So if the break is closer to the ball, where the ball and socket is, then there's always a chance we've had to do a hip replacement where we replace the ball with the metal piece and do either a partial or total hip replacement. Any way you look at it, therapy is involved after surgery. Most commonly, though, instead of fractures, most patients get strains, where they get called a hip flexor strain, where they get tendonitis or inflammation of the tendons surrounding the joints of the hip. Most of these get better with anti-inflammatory therapy and kind of laying off pickleball and any aggravating events. Sometimes these things can take 6 to 8 weeks or longer, depending on the type of strain and the severity of it. Next. So knee injuries, most commonly they're aggravations, particularly those older patients above 60 and 70, where you've got some arthritis. A lot of times they're aggravations of arthritis, where many of these will get better with a steroid shot and brace. Some patients will have what's called meniscal tears. So meniscus is in between the both bones in the knee. It's invisible on the X-ray, so to find it, it's an MRI. Still, even with meniscus tear, a lot of patients will respond with a steroid shot and don't necessarily need surgery. Surgery for arthritis is typically a knee replacement. Surgery for a meniscus tear is usually a knee scope, where the tear is removed. And obviously, fractures are always, a possibility of the knee. I think they're less common than the soft tissue injuries of strains and sprains and meniscus tears, but certainly those are possibilities as well. Next. This is an example of a meniscus tear. This is done through a scope. So it's an arthroscopy. It's a knee scope, 2 little local incisions. And next, you can see that here is the meniscus tear, kind of on the back left side. Next. So there's the, back one. There's the meniscus tear right there. And so what we did with this device is we removed the meniscus tear so the patient would not have this moving in and out of the joint causing him pain. Next. And then finally, going down to the foot and ankle, commonly patients can also have what's called an Achilles tendon rupture. The Achilles tendon is the back part of the ankle. And if you can feel it, it's kind of that wiry part just at the back part of the ankle that attaches to the heel bone. So many times with Achilles tendon ruptures, patients will be moving and you typically feel a pop. It's usually extremely painful. Bruising, swelling typically happens from it. And this is typically, again, something that's urgently seen within days at the orthopedic clinic. Whether you repair or don't repair it, it's debatable. Many patients can be treated without surgery with what's called serial casting. So every week or two, changing the cast so that we bring the ankle from being bent all the way to being upright and straight. And this could take a good 6 to 8 weeks as far as without surgery. Surgery is also another option. Surgery may have a higher chance of having less chance of having a re-tear if it's surgically repaired with incision and sutures, as the diagram shows below. Next. And ankle fractures. There are a fair amount of ankle fractures that do not need surgery. So these are the ankle fractures, broken ankles that come in with the bones are aligned up well. Nothing's dislocated or separated. And many of these patients, I put them into walking boots and gradually start walking and get back their motion. And usually the pain will subside once the fracture heals. There are patients like this that undergo surgery where we fix it with a plate and screws, even what's called a tightrope, which kind of repairs the ligaments between the 2 bones and the ankle. Surgery is needed, obviously, if it separates or if you've got what's called an unstable break. So when I say unstable, means that, all right, there's the break, and if you walk on this, I expect this to move, whether now versus over the next several weeks. So that's typically when we decide on surgery if the fracture is unstable, where we feel like it's going to move, or it's in an unacceptable alignment. Next. So prevention, right? We've talked about how popular pickleball is, the injuries from pickleball, how we treat them. And then this is ultimately now the part of the segue we say, all right, how do we prevent all this from happening? Pickleball is not going to go away. It continues to be a popular sport. It's probably going to continue to be played more and more at all age groups. So prevention, a lot of this is common sense. So warm up. When we talk about warm up, much of this is more like kind of balance warm up. So not just, well, I'm going to stretch out, the back part of my calf for a minute or two. A lot of this is like, I'm going to warm up. I'm going to do some jogging. I'm going to take 5-10 minutes to do some lunges, some knee lifts, jumping jacks. This is kind of not just to warm up your muscles, but also be prepared to stop. Pickleball, like tennis, there's a lot of stopping, starting, um, pivoting, and this will kind of warm up the muscles as well as also kind of warm up your body as far as balance. Um, Many of the injuries in pickleball happen because of loss of balance, where you've got to stop all of a sudden and you're not used to it or you're not warmed up, you have a higher chance of falling. The other thing is kind of the couch to court athlete. So pickleball, honestly, if you just kind of look at it, it looks so much easier than tennis. I mean, it's kind of like the stepchild of tennis, right? You look at pickleball and like, gosh, I could do that. I haven't played tennis in years. I haven't done this or that, and it's a wiffle ball. It's a small little paddle, and it's half the distance almost of a tennis court. I could do that, right? But these are the patients who are more commonly injured, or kind of the casual athletes, where I haven't played in so long. Let's go out there and let's play hard for an hour on pickleball. Um, so if you haven't played pickleball, I think it's important to take a lesson or slowly kind of get into it. If you're tired, take a break. Don't push it. Because many times if you're tired, you're going to lose that balance and you're going to fall and something's going to happen. Proper gear, obviously, tennis shoes, good traction. Don't pull out the shoes that are 15 years old that don't have any traction, higher chance of slipping. Beware of your surroundings. If the court's wet, right, or the gym floor is slick, nobody's mopped it or took all the dust. Be careful with that. Obviously, the higher chance of having injuries with that. And then, stay in shape and cross train. Again, I can't emphasize like the couch to court is usually not a good method to go down. Like cross train, stay in shape, get on a bike, elliptical machine, things that also kind of work on balance too. I think it's a good idea before getting on the pickleball court. Next. And then ultimately, aware of your surroundings, like we talked about, dirty floors, slick floors, avoid multiple pickleball courts, pickleballs on the court. You don't want to trip over a pickleball and fall and cause an injury. And then also, finally, like backpedaling. Backpedaling obviously is involved in a lot of sports. We see tennis professionals do it, playing the French Open and U.S. Open, etc. Right? They all backpedal to get to those balls. Um, maybe if you're 75, 80, 60s and 70s, balance may not quite be there. Not all of us are Federer and Djokovic and Nadal. It's harder, right? If you're backpedaling, it's easier to have a chance of falling. So you may want to turn instead of backpedaling and going backwards, jogging backwards. You may want to turn and run backwards. That way you can kind of see your surroundings and see what's behind you. Next.